My name is Kurt Johnson with Courion. What I wanted to do is walk through a case study of one of our customers that delves into some of the issues that I talked about earlier on the panel around the whole issue of access, and what the concerns are, what the risks associated with access, and what one organization is doing to address this and really mitigate the risks by taking what I call a portfolio approach, which is looking at the various technologies and how these all work together to provide a better basis around control around identities and access. And I want to thank Randy Yates, who's the head of security for Memorial Hermann. He spoke at our customer conference. I'm the exec sponsor that works with Memorial Hermann, so I've had the opportunity to work with Randy over the last few years, really delving into a very aggressive and very sophisticated security plan, security strategy, and he gave me the permission to speak on his behalf. Unfortunately, wasn't able to make the trip up here today, and I will do my best to do justice to some of the great work that he and his staff are doing at Memorial Hermann. But before I get into that, I just want to talk a little bit about what are the issues that we're dealing with here. And the reality of today is that open access is not really a choice anymore. And Walgreens is a customer of ours, and this is an organization that, as you know, has been around for a long time and is about as brick and mortar as it gets, where their business model is to get as many storefronts as possible in as many locations to make it easy for people to go there to renew their prescriptions and get other medical and health and beauty supplies. But I don't know if you've seen their most recent commercial. It shows a group of hikers going up the Matterhorn or to some aggressive hiking peak there, where one of them suddenly realizes he forgot to renew his prescription, pulls out his cell phone right there, whips out the Walgreens application, and renews the prescription. So I don't know how the heck he got a cell signal up there in the middle of nowhere, but that aside, it talks about the expectation of customers today to get access to information anywhere via any device at any time that they need it. Sensitive information such as prescriptions and the medical conditions and the allergies and all those types of things associated with it available to an individual on his cell phone. And this open access to give people this access to the information anytime, anywhere is enabled by the newer technologies. Our customers are demanding it in every aspect of their life, and our competition is demanding it. Making it easier to get access is one of the ways that many people are choosing to do business. And especially with the younger generation, with this full expectation of having their device at their hand, by their side at all times, at all moments, this is continuing to become a requirement. While at the same time, the risks of that continue to increase, not just from ex-employees or current employees who might have revenge on their mind to take misuse of this information, but organized crime profiting from it. It is now said that cybersecurity has surpassed the drug trade as the largest market of illicit and illegal activity out there. A friend of mine who works in one of the local Boston hospitals was telling me that they've actually seen organized crime trying to identify employees who can give them early access about athlete injuries. Because if they have an athlete that checks into the hospital, they can get information about that injury to manipulate betting prior to Las Vegas odds being changed about it. So these folks are doing some pretty sophisticated long-range thinking about what information can mean to their profits. Certainly disgruntled states are rogue states looking for power and control and seeing many attacks coming from many rogue nations, and increasingly the whole hacktivist organizations. And folks like Anonymous and LulzSec who've been making a lot of headlines recently about attacking organizations just to attack their brand, with the issue of having issues that they deem as appropriate, going after organizations to expose and embarrass them as a result. So you're dealing with more and more information being available and this increased risk. What can organizations do about it? And one of the complexities is access. That there are many day-to-day tasks such as hiring, promotions, transfers, terminations that require access to get turned on, access to get turned off, access to get modified. We have one customer who told us that they have about 10,000, 15,000 employees, and we went in there with our software and discovered some 30,000 active accounts. And almost double the number of employees with accounts that many were for people who've left the organization and hadn't been around there in a long, long time, who still had open accounts. When we were going through cleaning these things up and turning them off, there was about 20 accounts that they said, don't touch those. We said, well, why not? They can't find employees that are associated with them. They said, those are actually accounts for deceased individuals. And so we said, okay, why do you want to keep them there? And they said, well, it generally takes us 2 to 3 weeks on average to get an account set up for new employees. So we give them one of these accounts to use in the meantime so they can at least get online and start doing research and getting accustomed before we get their own accounts turned on. So you take away the creepy aspect of using some dead guy account for a couple weeks while you're starting the job. The worst part about it is when people left, they always remembered that dead guy account and the simple password rules that were used to get into it that gave them access to systems and was a security hole. Done in the name of service to get people because they couldn't get the accounts set up, it led to issues and holes. And that takes on multiplicative effects when you have numerous accounts that need to get turned on, modified due to acquisitions. Memorial Hermann in particular has been buying out many hospitals in the Texas and Southwest area, adding to hundreds and thousands of employees getting added. Children's Hospital here in Boston we work with calls it their baby doc influx. When they have Harvard students starting first-year med students taking on first-year rotations, first year's going to second year going to third getting full-time jobs or leaving the hospital. Literally on one day, hundreds of accounts that need to get set up, modified, disabled, and deleted. New system rollouts. We deal with people who are rolling out Epic or rolling out Cerner and have to set up thousands of IDs with the proper entitlements around all of those things. And the regulations, HIPPA, PCI, Sarbanes-Oxley for public organizations dealing with, one of the common themes throughout, though, is who has access to the information and what controls are you taking. And, we've seen that within HIPAA. HIPAA spells out numerous different things around a covered entity taking reasonable efforts around patient health information to make it just the minimum necessary usage throughout their organizations. A cover entity must identify those people who need that access and what controls are they doing to making sure that takes place. And certainly around business associates that we talked about earlier on the panel, and are they taking the satisfactory assurance that the business associates have only the access that they need? So we're seeing HIPAA taking more and more strides to get more and more stringent, increasing penalties, increasing frequency of audits that have many healthcare organizations concerned, and one of those aspects being access. And this is from a Deloitte survey asking what were the top internal and external audit findings across organizations across a full range of industries. And people with excessive access rights, more access than they're supposed to have, was the #1 finding, followed by developers with production access, lack of cleanup of access following a transfer or termination, segregation of duties, toxic combinations of access. Not only were these all among the top audit findings, but all increased over the prior year. And it's not just audits we're worried about. We're hitting the press with things such as when Congresswoman Giffords had the tragedy of the attempted assassination. When she checked into the hospital in Arizona, numerous hospital employees were looking at her medical records. So we see these kind of things hitting the news all the time related to celebrities. But it's not just celebrities. It's an attacker that was holding a Virginia hospital by holding patient data hostage, blackmailing the firm, saying they were going to release this if they didn't get their demands met. We saw this with business associates in our third parties. One hospital working with an outsourcer who walked off with a bunch of patient data. Johns Hopkins and an employee that stole a bunch of patient data for the purposes of obtaining fraudulent credit. HIPAA getting more and more, as I mentioned, that there was a recent incident where a fine of $4.3 million was levied, so we're seeing more of these hitting. And clearly the list that nobody wants to be on are the end-of-the-year summaries that list the top 10 hospitals and health systems that reported data breaches. These are the things you don't want to have happen to you, that you don't want your healthcare organization, hospital, up there in these kind of headlines. So what can you do? And that's where organizations like Memorial Hermann are taking a very aggressive approach to this in what we call an access risk management strategy, which ensures that only the right people have the right access to the right resources, and increasingly are making sure that they're doing the right things with that access. What steps can you take to truly understand who should have access to what? And at the end of the day, this is the business managers who ultimately own this responsibility for their employees. Do my employees have the access they need to do their job, but am I ensured that they don't have access to the stuff that they're not supposed to be doing? And how do we manage that when we've got unaffiliated non-employees who need access to our systems and are managing that? How do we manage that with patient portals who are coming in and accessing their own records to ensure that's secure? And things when a minor becomes 18 and his parents no longer have access to the patient records, how do we ensure that that is properly managed and controlled as well? All of these different type of things, and increasingly looking at what are people doing with their access, and not just the people who have access that's not appropriate, but the people who have appropriate access but are misusing that access to doing bad things, is all encompassed within this access risk management strategy. So with that, I want to talk about what is Memorial Hermann in particular doing to manage this, to look at the establishment of policy across the organization between line of business managers, IT, and security, and HR, to ensure that there's policies that everybody understands who should have access to what. Not only as the basis for audit, but as the basis of their broader risk management platform. What are they doing to enforce those access controls? To ensure that new hires, transfers, promotions, terminations are getting only the access they need, turning that access off when they no longer need it, and how do they verify and monitor this on an ongoing basis? And Memorial Hermann has taken a very aggressive portfolio approach to ensure that their sensitive information is being managed. So who is Memorial Hermann? They're a very large hospital organization based out of the Houston, Texas area. They have 11 acute care hospitals and 3 heart and vascular institutes. They also have a large rehabilitation hospital, made a lot of headlines when Congresswoman Giffords was transferred there after the moving from the Arizona hospital. Just to note that report and headline I showed earlier was not Memorial Hermann. That was the original hospital she checked in with, just to make sure that's on the record. They have 40-plus outpatient imaging centers, diagnostic labs, and treat a tremendous amount of patients, over almost 400,000 annual patients, plus ER visits, plus 25,000 baby deliveries per year. That's like twice the population of my town I grew up in is delivering new babies every year. They have about 20,000 employees across the Southwest, with over 5,000 active credentialed physicians, and they also have a significant number of non-employees, contractors, part-time workers, temporary workers, and I'll talk a little bit about the challenges of managing their access as well. So they really looked into this, and as a result of doing some internal inspections and really looking at a comprehensive risk management strategy across the hospital, really identified identity and access as a critical area that they needed to look at. And with the increasing movement towards more electronic patient health information across the hospital, they know they needed better controls around how to better manage the access that they provided to their caregivers, to these temporary employees, and to their full-time employees within the hospital. Some of the areas specifically identified was around enforcement of role-based access. How do we ensure that the roles that people have, which in their case was determined by location, hospital, department, and job function within there, how do we understand what the access is for those people and ensuring that the people in those roles and responsibilities have that kind of access? Dealing with some of the complexities of the smaller hospitals where people played multiple roles in the organization, even changing from shift to shift where they might be an ER nurse at one point and then a charge nurse in the next shift, dealing with what access they need at what particular times of the day. Tracking that user access to have full audit trails of understanding who got access, what access was modified, what access was taken away, and tracking those things over the lifetime of that employee. Timely disabling terminated user accounts, a big issue for many organizations with people who've left the organization, especially in their case where they didn't necessarily have visibility into this, into their HR records, where it might have been an affiliated hospital and the office staff at that hospital that are not Memorial Hermann employees but needed access to Memorial Hermann systems. How do we track all of that for their employees, the temporary employees, and these affiliated office physician staff? How do they get timely creation of new user accounts? Most people think, well, a lot of security people care more about turning it off than turning it on, but they had to turn it on appropriate, but they had to meet the needs of the caregiver environment. And in a healthcare organization, this is one of the most complex things because certainly we want our caregivers to have access to the patient data immediately for patient care and for patient safety. But at the same time, if we don't get that set up appropriately, we have concerns around them getting access to things they don't need. But if you don't turn on physicians' access quick enough, we know what they do. They share accounts. They say, hey, use my credentials instead. Or they do things like leave systems open and don't lock them down so anybody can have access to those things, because they will take shortcuts and circumvent the process if you're not providing the access. So in case of Memorial Hermann, they were very concerned about ensuring they get that to avoid the physicians ever needing to take shortcuts around those issues. The other piece was managing the access modification for transfers, a big issue that many cases in organizations, some of the biggest audit findings come from people who've been with the organization 20 years. They got 5 new jobs in that time, and they're pretty good about getting the new access they needed for their new job. But rarely did people go back and turn off the access they no longer needed. So you had access scope creep. And we've seen numerous cases where people used this old access for malicious or even inadvertent purposes because nobody ever went back and turned that off. Also managing access for going through a formal access certification process. And this is really getting the physicians involved of certifying their department heads certifying their employees, managers managing their own employees to understand which of my employees have access, and me signing off as a manager that that access is appropriate. And to do this effectively, it can't just be a rubber stamp. They really have to understand what is that access giving them and what can they do with that access. They're also taking a much deeper look at monitoring user activity so they can see exactly what are people doing on these systems, protecting their data, where their most sensitive information lies, what are they doing to protect it, and then managing this for compliance purposes on a comprehensive and consistent basis. So the first 4 phases that they went into was really dealing with a lot of these kind of issues. And they started with what's called the lights out provisioning for employees, what's called the leavers and the joiners within the organization. So they could have an automated process for as new employees came in place that they immediately got the access they needed, so they didn't take the 2 weeks plus or do what this other healthcare organization to give them a dead guy account to get it, that they got the access that they needed quickly, and more importantly, they turned that access off when people left. Lights out meant that this came directly from their HR system where their employees were. So as soon as an employee creation occurred, it automatically sent a trigger to set up the accounts. When a termination occurred, it automatically disabled that. No intervention from any people taking as much friction out of that equation. They also looked to automate some of the other areas that were most concerning around access. And one of these was their HR certification disable. And what this means is they have an active practice of tracking their employees' license certifications. So in the case where Medicaid and Medicare get pretty upset where you have people providing care when they are not properly licensed, this was a significant risk in the hospital. They didn't want the government to come in and look at the clawbacks for providing and taking away the funds that were provided to them when in the case a non-licensed person provided clinical care. So in their case, they actually track all of their employees' licensing. And what they were looking for, and the risk was a nurse, for example, who didn't pay her annual renewal for her license in time, or didn't get enough CME credits to get that automatically renewed. So they have a monthly feed that comes from their HR system into the Courion system to track those type of things. And what it will look at are all those employees whose renewals are coming up. They actually work with a third-party firm that's doing the verification of all the licensing. So they will send this list to that third-party firm and wait to get the validations from them that those renewals occurred. If they do not occur, and it's to hit that date that that person's license has expired, they will disable the account. They will send a notification to the manager notifying they disabled that account. They will also open a trouble ticket in the help desk with the reason for that. So then that person comes in, they are not able to get onto the network, they're not able to get onto the EMR system, thus not being able to provide patient care and giving them a control in that place. If the person said, hey, it was some mistake, there's a problem, They can call the help desk. The help desk will tell them why their account was turned off, and they can get an approval from their manager and from 2 people in HR, which will re-enable an account for 24 hours. If we did not get an automatic validation back from the third-party firm that that license was renewed by the end of the day, it will disable that account again. So it will continue to do this until that third-party validation has occurred that that license has been renewed, thus protecting them against non-licensed people providing patient care. They're doing a similar thing with HIPPA training, that they are tracking the annual HIPPA training that their employees have to go through. And if within 30 days of that expiring, the Courion system will send a notification to the employee telling them they need to go online and renew their HIPAA training and pass the test. If they don't do it, they will get a notification every day just to annoy the crud out of them that they have to go back in to renew this. If they never went and back in and passed the online test, it will disable their account, again sending a notification to the manager. The manager will also have a link that can re-enable that employee's account to give them access to the online training system to pass their HIPAA training. And in this case, when they don't, the manager will receive that notification every day, and we will go back and disable that account until that renewal has taken place. So they're using that automation to turn on and turn off access to meet whether it be formal licensing certification or HIPAA training. I'll talk a little bit about some of the other things that they were doing around physician office. BlackBerries was another one. That part of the termination process actually disables the BlackBerry to prevent anybody with a mobile device continuing to get access. The other third part about that was the change management and certifying that anytime somebody changed jobs, they got notification around that, and then dealing with the non-employees and having formal automation around that. What their portfolio approach was really a multiple approach that looked at planning, the automated identity and access management, roles-based access control, having a centralized security council to manage this, going through a formal automated access certification process that the managers use to verify the access, data loss prevention for tracking data, application and infrastructure log management, and pulling this together in a comprehensive compliance form. So I'll quickly run through some of these things. It starts with good planning. Despite as many technologies out there, without a good comprehensive plan, the technologies alone will not work. So they've got a 3 to 5 year security strategy where they basically outline and prioritize all of the key risks, the technologies or processes that will manage those, and they prioritize that with their senior executive management and a security and risk council within the hospital. They all come to agreement on what those 3 to 5 year priorities will be, what the costs involved with technologies, what people will be involved, and in their case, they actually claim it's easier to get money than it is to get people who can provide these functions. So both are a key challenge in doing this right. The security plan will kind of look at the specific pieces that came out as a priority as exactly what are those top things. So here are the projects currently in process. Here's what it is, here's a short description, and here's the individual responsible. So for example, they have a monthly process where they go out and look for weak Windows passwords by using a tool to go out and try to crack those passwords, creating a report and distributing that amongst the hospital. Basically, it's similar to kind of your IT service catalog within those of you familiar with ITIL. And then the policy catalog is a more comprehensive view of that, and that's the thing on top. So for each of those items in the security plan, it's an in-depth thing that looks at the overview of that, what the process is in specific detail, how frequently they review these types of things, what technologies are being used as part of it, and what metrics are they using to manage it. So all of these types of things are available to anybody within the organization to understand exactly what's going on and the next priorities. The life cycle management was what I was talking about before. What are the processes for bringing on board new employees and changing, managing kind of the changes of access and terminating those for the different user populations? Whether that be students who are coming on board, med students coming on board, full-time employees, temporary employees, they have flow charted out who makes the request, where does that come from, who approves that request, and how is that request created, whether it be automated or managed by some third-party system or handled by the help desk or the security administration. So for each job function, they know who needs to be involved, who needs to approve that, and in many cases leveraging the Courion system to automate that as much as possible. Their role-based database really kind of looks at all the different roles and functions within the hospital. So in their case, for 20,000 employees, they have about 300 roles in their role database. And what this is a listing of the specific role, what access is granted to that, and which individuals within that hospital should be receiving that access. In this way, it enables the automation, so when a new person comes in, by putting them in that role, the system automatically knows what accounts to create. When somebody moves from role A to role B, it will do a comparative match against that to see which access they continue to get, what access changes in those systems, such as a new AD group or a new entitlement within the Cerner system, and which access needs to get taken away. Then they have new hire requests automations. This is being used specifically for things such as the office employees that are affiliated with a physician of the hospital, but not necessarily an employee of the hospital. So, for example, it automates one of those flow charts you saw before. So in this case, what happens is the office staff makes a request via an online form, filling out who they are. They also have to identify which clinician they are affiliated with. By doing so, that automatically sends an email alert to that physician to approve that request. So they verify that, yes, this employee is part of our office staff. It verifies that here are the access that they need, and they physically sign off and approve that using their Memorial Hermann credentials to access that system for approval purposes. Then, once that happens, it sends an automatic request to the Courion system to set that account, sets a username and a password, and the password is auto-generated through pieces of personal information that they submitted on the form, as well as a PIN that they used in filling out that form as well. So only they know what that password is and can get into the system. This enables new employees to get access that they need quickly. This used to be a 2-week process at Memorial Hermann and took over 30 minutes of security staff time. Now they're doing all of this with no human intervention whatsoever other than the approval, and those accounts are created immediately. Similarly, for other kind of online requests, self-service employees can request things that may be outside of their role that they need access to. And they've got a specific, easy way for the employee to do this, to send it off to the proper approvals, and to track those things so they can see any account that was created outside of a formal policy or role. And the idea is to try to make this as much like an Amazon-like experience where, based on what their function is, maybe limiting or filtering what types of accounts they can ask, what types of entitlements, and hiding a lot of the technical complexity and doing this in layman's terms. Also providing a security counsel. This is where HR can go to track and let me see all the accounts that were disabled because somebody didn't renew their license. Let a manager go and see all of their employees who haven't passed their HIPAA training yet. Let a security person go in and see all of the accounts. So all of those different tasks are available on a console where they can click and get a chart to see which accounts were created, what systems were those created, what are some of the upcoming events that I need to do, such as an access certification review. Which leads me to access certification, putting in policy and automation so every manager on a periodic basis gets this, which shows all of their employees, what access those employees have, and may highlight access that is outside that role of that person. So they can formally sign off on that, saying, yeah, Kurt needs that access because he's performing a specific function on a temporary basis. Or maybe it's for people who are no longer with the organization. I can remediate and terminate that access right here on this periodic review. Putting managers responsible for this, getting them associated with this. This is what they use for their physician offices. So the physician who is affiliated with Memorial Hermann still has to verify that all those people who requested access still work within their specific office, thus creating more controls and more automation to ensure that the people who have access need it. DLP, data loss prevention. In their case, they say, I don't need DLP to find sensitive data. I know where it is. It's everywhere. So they do a comprehensive policy to make sure that any data, sensitive data transmitted over the internet is controlled and encrypted, that they block information from being sent to things such as Gmail or Yahoo accounts. They prevent things from happening like being put on USB drives or on iPads or other e-readers, and doing a significant amount of scanning of data at rest to understand what's sitting on file shares, what's sitting out on SharePoint sites, which are a significant concern for many organizations, to understand where is our sensitive data, identifying who has access to that data, and giving managers control over that process. Finally, last couple things, log management. They're looking both at the infrastructure, leveraging ArcSight to track what's going on in the infrastructure, but more and more using fair warning to actually see what are people doing in the clinician system, what patients are they looking at, what behavior patterns look outside of normal, and tracking this activity to enable that to be alerted to Courion to turn off access when it looks like people are doing things inappropriate to what their normal job function is, also alerting managers to those types of things. And then finally, establishing a GRC common system framework, which is extremely important. They have a security privacy governing body that includes CIOs, hospital representatives, IT representatives that get together to look at those plans, to understand the priorities. They communicate with that council on a monthly basis with meetings where they use pretty charts and graphs because people like pictures, keeping it simple, making sure it's very intuitive to them, but also looking at implementing a GRC system for consistency. So instead of having spreadsheets and Word documents and other documents everywhere, that when auditors come, they can have a consistent way of looking at this on a common framework, in their case using the high trust framework to really help manage how are we defining risk, what are the priorities, and ensuring that the chief security officer isn't out there on an island, that it's a representation of the formal governing body to understand what are the risks and what are the priorities in the organization. And running short on time here, the key thing is pulling all these things together, looking at all this data across the data loss prevention, the user activity logs, the identity and access management data, to give them this comprehensive view. Because the data is everywhere, and they want to know who is accessing it, why are they accessing it, and did the managers approve that and understand what are they doing with this. So they need to understand who has access, to what are they doing with it, and understanding that it's going to take numerous technologies working together to do this. But by being able to do this, they can automate more of these types of functions to provide increased controls, increased tracking, and where some of their key risks and concerns can be mitigated by automating and removing that access. Next up, cloud and mobile for them. They're looking very much at the cloud environment and the mobile environment. At first, Memorial Hermann said, no sensitive, no patient data is going in the cloud. And then all of a sudden, one group of doctors wants to do this project, and it's only available in the cloud. So they updated the policy to say, if there's a premise app, we won't do that, or we won't implement the cloud app unless there is no premise app available. Now looking more and more at that, they're seeing more and more cloud come into their environment. So they want to get ahead of that curve, understand the mobile devices and what information is being managed on that. And again, by having this 3 to 5 year view with as much automation as possible integrated in this council, they can have a consistent view of that. And I apologize, I've gone over on time a little bit here. I'll be available at the break to answer any questions, but hopefully this gave you a better look at some of the key concerns and what one sophisticated organization is doing to address it. As I mentioned, my colleagues are available in the back, and we can talk more about these kind of solutions. And thank you very much for your attention.